People, una welcome to this special edition. This one a special edition because I don't do one video on sexually transmitted disease and I talk for that video say make people choose any sexually transmitted disease una wan know more about. Two special people come respond. Na im make I carry this video come. Now welcome to Think Health with Dr. Nature. You know, so we dey learn different health issues wey dey disturb us or wey we wan know about am. Ayawo, we go start sharply. Wetin come be the wetin dey choose na herpes infection. Both of them choose say they wan know more about am. Ayawo, herpes infection na wetin herpes simplex virus dey cause. You see as I talk am, herpes simplex virus dey cause herpes infection and na sexually transmitted disease im be. You know say about 3.7 billion people wey dey less than 50 years get this virus. Plenty people. And e get two type 1, and this one why I talk na for type 1. For type 2, over 491 million people worldwide get am. Dis na serious matter. E dey very very common. And many of us, by the time I go show una about am, you go know say im dey common. So the type 1, how people take dey catch am na from oral to oral, that's from mouth to mouth. Even simple, you wan greet your grand pikin or you wan greet your friend, you come peck, you carry am for mouth, you go come dey share am. Na so, or even kissing, or even oral sex. Na so we dey take catch this one. But the herpes simplex virus type 2, na that one be the sexually transmitted infection gone. And na wetin dey call genital herpes. The type 1 dey do for mouth, the type 2 na down for our genital area in dey happen. E don dey clear. So wetin come be the symptoms? When e show for body, you go know. Yes, the symptom no dey hide. For mouth, you go see am. Many of us dey get this kind thing for mouth. You go say, wetin dis, and e dey pain. You go start with pain before you come see say e be like if hot water do you for mouth. Then rash go come follow. E dey very common. As dey show for this video, you see as e take be. They call am cold sores. Some people dey call am canker sores. You see, as when e come show for mouth, many of our people go say, na malaria o. And this thing wey dey from e dey pain. E dey pain when certain person no fit chop. Even when you wan chop, be as if pepper dey your mouth. E fit also be like this inside the mouth. Na so the type 1 dey take happen. The type 2 nko, that one dey go for siki. Dey go for our genital area, for our private area, and you can't get pain, wound, ulcer for the place. If you wan do, and the pain dey pain well, you know dey show mercy. And if it dey plenty, come scatter different places. If it be like if water dey come rupture. And the funny thing, if person come do oral sex, if he carry the type 2, go for up for mouth. So person fit get type 2 own for mouth, even though na type 1 dey there. I go apologize for this video where you go to see the pictures where you go to see. This one are real pictures of people where if make una sabi how e take the show for body. If it be like this, if it be like water, we will come burst, it will come be like wound and in the pain. And if it come again and again, some people say, I don't get them before, doc, and it will come happen again. It's true. If it reoccur, now it make you need treatment. I know so for that sexually transmitted disease, at least some sexually transmitted disease wey no dey get permanent cure. And for women's side, if they be like this, if it dey red, they no mind the color, and it can dey multiple, and it dey pain, it dey pepper. All na the same thing. And if some people get fever put, if it happen, yes, person fit get fever or body pain, so he make people dey think say na malaria, but no be malaria. As we don hear and reach, so wetin we can't do, why we go come worry, why we can't worry about this? Now because when you get herpes infection, to get HIV na sharp, you get 3 times risks of getting HIV because wound dey your body now. So when you can't do, you can't catch HIV fast. And if you can't carry belle, you be woman wey get am, you fit give am your pikin, innocent pikin. No, now you make the matter where cap come. Make una lis ten and make we learn. So as we can't take reach here, how we can know prevent say make we no catch am if you never catch am, or make we no spread and give another partner? Number 1 na to avoid contact with others when you get symptom. If that thing show for your mouth or show for that downside, make we avoid contact. Even to greet, I peck you, we do oyibo, or even to children. without knowing we fit spread am give, na im make many of us get am. And if you know say person get wound for that area, abstain for sex for that moment. No be say you no go do for that moment until the person gets full treatment. No be say you no love the person, you even love the person, so you no go give the person another wahala put inside. So you go abstain for sex for that period wey you get symptoms. You can't apply safe sex. So I no fit hold, I no fit conjugate too much. You go use condom now. Even for that previous video where I talk about sexually transmitted disease, I mention dental dam. That's when they put for mouth or for the sexual area, so that when you want to do oral sex, you no go catch am. You still fit use them. These are ways where you fit prevent them. So wetin we can do if you get or you know person wey get this kind of problem, you go tell the person make you run go see doctor. They get doctors wey dey treat sexually transmitted disease. They call them dermatovenerologists. Most of them they call them dermatologist, skin doctor. And when you come meet them, they will come treat you. Make you no reoccur too much. As una don learn reach so, I know say I believe say una learn something put for this video. Make una no forget to like, make una no forget to comment. You fit make requests for more sexually transmitted disease wey you want wey we explain. Una bye bye.